Our next guest is seated right here. He is the governor of Murang'a County, Dr. Irungu Kang'ata. Good morning, Governor.
Good morning.
Good to have you here.
Thank you so much.
Karibu tena sana.
Asante.
It's been a while.
Thank you.
Murang'a is far.
Yes, it is.
Welcome. I see you've won something written, Inua Mkulima.
Yes, indeed.
What is that about?
We have a program which targets farmers.
Mm-hmm.
And therefore, this is like the catchphrase for those programs. That includes a subsidy program for mango farming and milk. If you are Murang'a milk or mango farmer, there's a card we give you called Inua Mkulima, like an e-voucher. You go to a supermarket and you redeem farm inputs for your animal husbandry. That is things like milking jerry, animal feed, salt, for free.
Okay.
But you use that card now to redeem those set of goods. If you are hungry, for instance, you also get certain goods like flour, milk, flour.
With the same voucher?
Yeah. Bar soap, such. Up to a limit of the money that the county has put into your card. And the rationale is to incentivize farmers to join cooperatives, because the reason why farmers do not get the value of their effort is low prices. So when you aggregate them, you leverage on their numbers, you push up their prices. But also this program has a new element we call support to maize farmers. Maize farming is a food security issue, and the county of Murang'a has come up with several interventions to boost maize farming. We are providing free certified hybrid seeds to 57,000 farmers, plus free fertilizer to farmers. And from today up to 12th of October, we shall be distributing that consignment in all wards. The distribution starts today.
Well, you'll tell us more about it. Very good. Very good. Our brother City is not in today. Hasn't been in since last week. He's taken some few days off, but he'll be back. But in his absence, he told us the proverbs to give our guests when they come. This week, the proverbs will be from Senegal in West Africa. Have you been to Senegal?
No.
Yeah. I hear you should go to Senegal.
You should.
And you said Senegal has like a country that it has like fully...
It's almost surrounded. It almost surrounds the Gambia. Yeah, but then Gambia has a coastline, so it juts in and out.
So but for the coastline,
it would have swallowed
Gambia would have
the way
inside.
South Africa swallowed Lesotho.
Bas.
Yeah.
The proverb for today, listen to it and give us your interpretation. It is better to travel alone than with a bad companion. It is better to travel alone than with a bad companion.
Yes, so...
What's the interpretation of that proverb?
That it makes all the sense for you to do things singularly as opposed to bringing bad company that can bring you down. Yes.
But how do you identify the company that can bring you down?
Skill sets, reputation of that other person, experience of that other person. It all makes sense for you to seek counsel of people who are more sharper than you, so that you get their wisdom.
Those who
let's
will
say,
help
for
you.
instance, let's say you want to do an intervention in healthcare. For instance, as a governor, I'm not a medic, so I need to get counsel from doctors. I would imagine that is a rationale.
Okay. So I'd imagine it's the same kind of thing that you thought of when you created, a revenue board and an economic council of advisors who have been helping you. And with that, the other day you credited them for the performance, the financial performance of the county government, right?
Yes, Waswahili husema kuishi kwingi,
kuona mengi.
These fellas came from Murang'a when they were young. They went to Nairobi. They conquered the city. We are talking of likes of SK Masharia, Jim Nambaru, Peter Muga. So we thought that we need to take advantage of their wisdom to help us push up Murang'a ahead. We are happy that when we joined Murang'a County Government, we used to collect about 500 million own source revenue. But within 1 year and a half or so, that has been doubled to 1.1 billion Kenya shilling.
Okay, that's very interesting. We saw the numbers, Governor, and I mean, we're looking at double plus in a year, right? A little over a year.
Yes.
So the very simple question is how?
2 ways or 3 ways. Number one is to motivate your employees because they are the one who actually do the collection. So we had a seminar that we called it the revenue conference. And we told them the rationale or why Murang'a needs to collect more money, which is one, to execute various developmental programs for the people. Secondly, currently Murang'a has a huge workforce. We pay our salaries about 46% of our total budget against the law, which is should be 35%.
You're breaking the law?
Yes,
Okay.
we are. We ought to fire people so that we reach the 50.
Or you grow your
35%.
budget.
Or we grow your budget. So to circumvent that, I told them, you guys, I don't want to send you guys home. I know you have families. The best way is to grow our budget. So I think they got the message. We also converted their terms of employment. 90% of them were casuals. They do not have letter of appointments. So we give them contracts. Now they are able to access loans. Maybe that motivated them to collect more. Secondly, automation. We have about 30 revenue streams: parking fees, markets, cess, hospital, lands. We have been able to automate all of them. So we are able to track county revenue in real time. You people pay at their convenience. You find a person can pay for, let's say, parking before even he arrives to Murang'a town or wherever. And that has made collection of revenue a little bit better.
Okay.
Finally, we don't overtax our people. The last time Murang'a had a finance act was 2018. We don't have any new finance act, meaning for the last how many years? That's about 6 years. Murang'a County has not increased its revenue, its charges, whether it is single business permit. So, and also what we told the people is, at least to come up with programs where you are able to see where your money goes to. Whether it's Smart City program, this Kangata Care, or this Inua Mkulima. Once people see that correlation, we suspect maybe they'll be more than willing to support the county.
It sounds almost mysterious, Governor, and many would wonder that it's actually possible for you to use the resources that are available, but just tweaking a few things here and there, and actually not raise taxes, but grow an economy, whether it's at the county level, whatever level it is, that you can grow your economy, because that's what we're talking about. When we're talking about increasing revenue, what you've done is that you've grown the economy of the county. And it's possible to have done that without raising taxes to the extent where it's throttling the people.
Yes, but of course there are problems, and we also highlight challenges.
Please do.
Number one, these systems are internet-based. That means whenever there are internet challenges, you don't collect money, or even systems.
When systems are down.
When they are down,
You don't.
the county stops, literally. And some of these systems are also, they have a direct correlation with human life. So a good example is our automation of our hospital systems. So whenever they go down, you are jeopardizing people's lives. We are thinking of how to mitigate that, including creating what we call redundancy systems. When one system is down, the other one is up. Also, hosting those services in clouds helps, because rarely will you find the system going down when it's hosted in clouds. Such efforts. Also, being technologically driven, then there's some people who might not be able to interact with the same system very well. Our grannies. So that then means we have to constantly keep on training our people, having officers who can shepherd those who are unable to interact with the systems. So challenges exist.
There are many challenges. 1.2 billion shillings raised as own source revenue, right? Up from 500 million. But what is the projected revenue capacity of Murang'a County, say by the Commission on Revenue Allocation?
They talk of 3 billion.
3B.
Yes, they talk of 3 billion. Yes.
Do you agree? Now that you've served as governor now for 2 years, when you look at Murang'a, do you think Murang'a has the capacity to actually raise 3 billion shillings?
Yes, but you really need a lot to do a deeper conversation. One of the assumptions inherent in that projection is the idea that you will add extra levies, people will pay more, but that's a difficult conversation you have with your residents, because people can fight back.
Yeah,
you saw Gen Z. So I think that's an area, it's a conversation we really need to have with Murang'a people.
What's your projection for this year?
About 1.35, an extra 150 million. We tend to go in a conservative manner. We prefer we hit the target. We really like having what we call a deficit budget. Deficit budget means you project, let's say 10, but you
raise 8.
You raise 8. So that then means that's 200 million is a deficit. So we prefer the opposite. You indicate 10, you raise 10 or 11.
And that's working for you so far. These programs that you're running, for example, the one that just told us about the Inua Mkulima, right? In even the previous government, there were farmer programs that were going on. So are you saying that you did away with those other programs that were going on before and now you have started this one? Or are there elements of the previous farmer support programs that you're carrying on?
It's both new and continuation. The milk and the mango are newish to a certain extent, particularly the way we have structured them. For instance, but of course we do have continuity. Good example of continuity is the Maragua milk factory. It was started by the previous regime. It collapsed some months to the election under huge debts. We revived it, but we took a new philosophy that is not wise for governments to do business. So we gave it to the farmers cooperative to run it on our behalf. So it has been revived. Secondly, this maize program used to be there, but it has been retweaked. One, previously they used to buy the maize from private people. Currently we are buying this maize from government. Simlo Seed and Kenya Agricultural and Research and Livestock Research Organization, KALO. Yeah. That's the difference. And also we want to commercialize the engagement. We believe the reason why Kenyan farmers are poor is because they produce things they either consume without selling or they have no connection with the industry. The day we will be able to create a connection between a farmer and the market, the industry, particularly the value addition entities, farmers' incomes will rise. So we have been entering into MOUs with various manufacturers of agricultural products. We tell them, give us a guarantee price, then we mobilize. That way, they get what they want, which is the produce, and then the farmers' income go up. Because farmers know now this is what we shall get after we produce. So, for instance, in the mango, we entered into an MOU with a company called Kevian in Thika, producers of pick and peel. Also, Sane Mango in Kambiti, Murang'a. They give us a guaranteed price of 16 bob per kg. Previously, Murang'a mangoes used to be sold at about 2 bob or 3 bob per kg.
Wow.
So that's a rise up to 16 bob. Currently, we got another company from Machakos called VATS, which has told us it will give us 18 bob per kg. When it comes to maize, we have an MOU with Joy Millers, who do Kafagara brand in Kirinyaga. They are giving us a guarantee of 3,500. So we think if we are able to achieve this, we can help mitigate rural poverty. Yeah.
And then you said this is by mobilizing farmers into cooperatives.
Yes.
Okay. Yeah. So how many cooperatives are there in Murang'a now? And how many farmers do they represent?
Cooperatives are just too many because it depends on which value chain. Yeah. Let's say, for instance, in the milk industry, we have the largest single union, which is called MCCU, but it has about 32 small cooperatives under it. Then you have another large milk cooperatives. We call them the Big Five. So there are many cooperatives. Yes.
Are all farmers now in cooperatives? Going by your assessment, by how they're getting the cards?
Definitely no. Some people sell to private people, to brokers. But to us, that's neither here or there. The logic should be push up the price of the cooperative.
Right.
Even the brokers will be compelled to hike
to compete at
that level. A good example is in the mango sector. When we formed the Lower Murang'a cooperative, we pushed up the price to about 16 bob. The brokers also have to do the same. Same way with in the milk sector. Now cooperatives are now getting more milk compared to the situation before, because now people are saying, if I join a cooperative, I'm going to get these benefits. Same way with maize, they are huge brokers. We suspect that they will aggregate farmers. The price of maize will rise. Then the broker can remain, but he will be competing at the county price level. Yeah.
Interesting around here, you or the previous governor talking a lot about the cash crop of the traditional cash crop of Murang'a, coffee, tea.
And I think for a reason.
Why?
Those are statutory crops. Statutory means they are highly regulated here in Nairobi by national legislations. And therefore, the extent through which a county government can intervene is a little bit constrained. We have KTDA that handles tea. Coffee, also you have many boards here in Nairobi. So it is mainly, yes, it's an agricultural crop, but highly regulated. And therefore you find we can only do as much as a county government.
Okay.
Yeah.
Okay. So when you look at it, is it clear who is taking the reins? Is the county very clearly taking the reins of centrality now and saying, look, this is the way in which things would be done, and everybody is more or less falling in line? Or is the county giving the people an opportunity to say, okay, what is it that you do? Let us see how we can support you. Which trajectory does it take?
I think it's both. It's both. There has to be leadership on the part of the county, but it's also a constitutional imperative of public participation and people involvement. We synergize. Yes.
Okay.
Let's take a break. We come back and continue, and we will talk about Kangata Care. All right. So we are now looking at rolling out universal health coverage across the country, and we've heard about what you've been doing with Kangata Care for a while. We want to understand how Kangata Care is working and how it will fit with a bigger picture countrywide. Governor Dr. Irungu Kang'ata Wabarua is here. He's our guest this morning. Ndu.
All right. Looking at Kangata Care, it's something that you touted a while back, and very intrigued to understand exactly how that works, because somehow you're able to get people in the county under care and they can go into hospital and be treated. How is this working?
First, we prepared a policy that was passed by the Assembly, and the policy now indicates the logic, the rationale, and the structuring of the program. Basically, every year we announce a date to the public and we go and recruit poor people who join the program. And the criteria mainly is vulnerability. So it tends to be uptaken mainly by the elderly. Once you join it, there are a set of benefits that you get. One is inpatient and outpatient free services in public and private hospitals that are aligned to NHIF. Secondly, free optical. Thirdly, free dental care in public facilities. Fourthly, if you are referred outside the country for treatment, you are paid 500,000 Kenya shilling. If you pass on or your dependent passes on, you are entitled to Kenya shillings 100,000 as last expense. Also, emergency evacuation by an ambulance that is affiliated to NHIF. This the first year we had 20,000 households. This year we have 40,000 households. Assuming one household has about 3 or 4 dependents, that's about 160,000 persons who are under this program. Basically, that's how it works.
Okay.
But let me also clarify. We entered into an MOU with NHIF detailing all those points I've stated here.
Okay. So it's benefiting 40,000 households. These are the ones that you've registered as the needy ones?
Yes.
40,000 needy families?
Yes.
How do you identify? What's the criteria for identification of need?
We usually indicate in our poster when you are recruiting the criteria, which is mainly it's weighted. We come up with a weighting. Let's say if you are an orphan, you get 20 marks. If you have disability, you get 20 marks. If you don't, you get 10. Yeah. The other weight will be diseases. Do you have chronic non-communicable diseases like hypertension, diabetes, mental illness? You get, let's say, 40 marks. If you don't, you get 20 marks.
Disability.
So disability, such.
Okay.
But and then we recruit per primary school. The idea is to ensure equity. So we tell people to go to their nearest primary schools on a date that we have indicated. Then we give each school should recruit a certain amount of persons. You'll find, let's say, Murang'a is about 600 primary school. So for 40,000 slots divided by 600. I don't know how much is that.
We can find that out.
So
80.
So you say we will on average each school should give us 8 households. But the truth is, the last time when we were doing recruitment, we wanted to recruit about 30,000 based on our budget, but the people who came out were 43,000. We decided to recruit everyone, so no one
is left behind.
No one was left behind. We said we will maneuver to get resources elsewhere, but the point is no one failed except those who are knocked out on technical grounds. Technical grounds means the people who came for recruitment so we had a 43,000 long list. Then we took those names to NHIF for onboarding. We realized some, for instance, don't have the ID is incorrect, or you're already on NHIF without you knowing. There are some people who are in NHIF without their knowledge. You see, NHIF, the way it was structured, it used to have special schemes that are paid for by the governments. I think there was one that I don't know was targeting, I don't know who, chiefs were to collect names. So those names were onboarded. Already. And the government used to pay for them. But it appears people never used to know they are actually on NHIF. And the reason was, one, poor public education by those governmental schemes. Secondly, NHIF stopped giving out cards, physical cards to wananchi. So people, you can be on NHIF, you don't.
But you don't have,
because you don't have,
because you don't have. So as we flipped that logic and give our people a physical card, then we knew that once people get a physical card, that will boost utilization rate. Yeah.
Has it changed? That utilization, the hospital visits.
No,
on account of now that you are covered, are people's health-seeking behavior different?
Yeah, one, of course, definitely people are happier because you see now they know they are well covered. But of course, people don't go to seek medical services on account that they really want. They only go to when they are actually sick. However, there are people before who you never used to go to hospital on account they can't afford. So now this definitely removes the cost barrier to seeking Medicare. But it also brought a challenge, which is people seeking medical services at our level 4 hospitals increased. Murang'a, before we came into office, immediately we came to the office, it used to record 700 persons outpatient visits per day. Currently, we are doing 1,500 per day.
Seen and treated.
Seen either. These people never used to come to the hospital. They were just sick and staying at home. That's one possibility. Or because we also automated our health records, maybe there are people who used to come to the hospital, they were not recorded, and they would get service and go home. Now that we are now able to,
you're capturing it.
We are not capturing that, either of that too. But we think there's an element that people used to get sick and not seek service. But of course, now that brings a new challenge that now you have to look for more money to treat those people. The HR component, the medicine, So it has a negative element or a challenge. Let me not use say negative, I say a challenge. You'd imagine 1,500 people seeking services.
You've increased demand, so you must meet that demand.
You must meet that demand. Yeah.
What does it mean then in this transition? Now that NHIF is no more, and you had signed deals with NHIF, have you signed deals with Social Health Authority?
That's a very sharp question. That's a very sharp question, and I think one of the most important questions we have dealt we need to think about. When we were signing that, our current MOU, I think it was in December last year, we anticipated problems. We inserted a clause that indicated that once these changes come into force, we will seek to revisit the MOU. And coming into force means the effective date, the start date of SHIF. It was shifted. It is now set to be 1st of October 2024, the next 2 weeks also. 1 week, by the way, from now.
Yep, it's next week.
Yes. So last week, we went to see NHIF management. We told them, now, look, you guys, are
dead.
We have a problem here.
The funeral is next week.
Now what do we do? There is, in their understanding, they wanted us to continue with Kangata Care up to 31st of December 2024. On the basis there's a clause in the new law of NHIF that seems to say any
existing
arrangement can be saved up to 31st. So they were telling her, you guys, you pay your premiums.
You're sorted.
You're sorted up to 31st of December. But we are not minded to agree to that for several reasons. One, SHIF is cheaper than Kangata Care or the older NHIF. So you are telling me to pay. We currently Kangata Care pays for one household about per month 820 Kenya shilling. You know, these are what we call enhanced covers. But SHIF says for poor people, indigents, they should pay 300 Kenya shilling. So on what basis do you want me to pay for the same service? At 820, which is already in place.
For less.
For less. I don't understand. Doesn't make sense.
So will there be a shift to SHIF?
I wrote a letter. I think last week I told them, you guys migrate my people from Kangata Care to SHIF.
So what happens to the program?
It continues. You see, what are they? You know, SHIF. The philosophy of SHIF is that everyone should be treated equal. We don't have two sets of benefits or beneficiaries. So it's like amalgamation. So we are arguing, and by the way, national government, they used to have a civil servant specialized scheme. It has shifted out of NHIF. NHIF owns stuff. They were under a certain specialized scheme.
They have their own scheme.
It is also been, it is ending by 1st of October.
So all of them are being brought back now to
SHIF. So I'm saying the same logic. SHIF. You shift my people to SHIF. I pay at a cheaper.
The new rate.
The new rate of
300 per household.
Per household.
Because it is working.
Well, whatever. It is the law. Why, you see now, surely, assume I continue paying 820. What am I paying for? What specialized?
There's nothing
service?
Extra that you get.
What extra am I getting? There's nothing. There's nothing. Doesn't make sense. There is nothing. So I told them, you shift my 40,000 households to SHIF. I pay you SHIF charges.
As far as you know, with just less than 10...
let me also just mention, SHIF will give almost, in fact, will give better benefits package.
It's more benefits.
Except last expense. It doesn't have a last expense component. So that single component, we have externalized it. We did a tender, and a company called Britam won it. We are waiting for the standstill period to end. We sign off. By the way, they have promised us heaven. Because you see, apart from the 100,000 that we shall be giving to members of this scheme, they are proposing to give us welfare packages. That is, if you're under Kangata Care, going forward, if you get a child, you get 10,000. I think if you marry, I don't know, 25,000. Yes.
This is what the company is proposing.
Yes.
Britam.
Yes. If you get a child, if you get a child, 10,000. If you marry, 10,000. If you have a child going to school, high school, you get 25,000 school fees.
And still, in the event of death, 100,000.
100,000. That is the proposal.
For any member of the household.
Yes, any member.
And people have to do what in order to get into this?
Nothing.
Just be
It's just the county that's going to pay.
The county is doing this.
Nothing. Nothing.
There are less than 10 days to go,
Yeah.
Governor, for the shift to SHIF. Now, of course, you need to see that your health facilities in Murang'a, from level 1, 2, 3, 4, all the way to 5, you have level 5, right?
Yes.
That all of them are then now ready and integrated to the migration, so that when your people go to seek health services in any of these facilities, they will get the services. Is that happening?
Yes, as we are ready, I think it's the Ministry of Health that we are hoping it is ready.
Is SHIF ready?
I don't know. I really don't. I hope so. Let me
Okay.
say, I hope so. I hope they are ready.
Maybe I should ask it at Council of Governor level, right? This transition from beginning of next month, how is it going to work? Because all these facilities are actually managed by the county governments.
Practically, services will run. What might tax our minds in the worst case scenario is the funding. Who pays for our services? So I think Kenya should not panic to the extent that SHIF or even HIF does not offer medical services. It is the counties that have doctors, that have medicine, that have all those things. Probably I would worry if the private sector now refuses to offer services on account that SHIF is yet to be settled well. So us will continue offering service. The question that we might grapple with is who compensates us for this service? Yes.
What conversation have you had with the national government? Because there are 3 tiers in service provision now with the Social Health Authority. There is the primary healthcare bit that is 100% taxpayer funded, where you're telling somebody in pick a village in Murang'a, Kamasharia, and they go to a dispensary there. They should go to a dispensary in Kamasharia and go back home.
Treated without paying a dime.
Yeah. If you are traversing Murang'a and you're involved in an accident, you should go to a facility and the emergency care cover should sort you out. Again, taxpayer funded. Are those aligned?
We had a meeting with them, I think it was last week, when and they seem to be suspending some of those benefits. I think the one for emergency seems to have been suspended. They want a more timelines to be able to transit into that area. So probably we wait and see what happens. But it appears the core, the main package is ready. And from where we see it, and I would imagine all counties have the same philosophy, we should not create a notion among the people that if SHIF is not ready, services will grind to a halt. What I would suspect might happen if SHIF is not ready is services are offered, counties are now fighting with SHIF for reimbursement. I think that would be the worst case scenario. Yeah, we fight with the element of reimbursement.
Okay.
Yes.
There's a piece of legislation called the Facilities Improvement Fund, right? That says that now we are ring fencing money within facilities so that you can improve those facilities. Facilities are run by counties. Our county is ready. And for example, is Murang'a doing that? Is Murang'a ring fencing money from specific facilities so that it goes on to improve those same facilities?
Yes, we are. We came up with a system, an automated platform, which basically is with all our eight hospitals. They can now procure through that system. So meaning if you raise a requisition, it goes to the platform. Then there are certain approval levels from the Director of Procurement, Chief Officer, Health, and then an LP is generated and goods are delivered. So far, it seems things are working well. We have seen several things. Number one, revenues have gone up because now the people who are heading facilities are a little bit better motivated because they know whatever they are generating remains in the hospital. Also, the automation has made it a little bit simpler for things to get to the hospital. So from where we see it, things look better. A good example is Murang'a Hospital.
Okay. How much does Murang'a County owe KEMSA?
Let me first finish that.
Okay.
So Murang'a used to generate, I think, per month about 1.6 million Kenya shilling.
Murang'a Hospital?
Yes. Currently, we are now doing 10 million, headed to 11 million.
From 1.6.
Yes, that money is now retained as the hospital or the main hospital.
It stays in hospital and continues operating.
Yeah. Same way you find like Kenneth Matiba, who is now generating about 1 million Kenya shilling. Maragwa used to perform very poorly, about 1 million Kenya shillings per month. We are now doing 4 million. So the point is, I think those people who superintend those hospitals, now they have better cash flow to deal with the problems that arise in a hospital. We are no longer controlling that money at the center. How much we owe KEMSA? Last time I checked, it was about 19 million. But the figure keeps on fluctuating. But we are among the best counties in terms of owing less to KEMSA. Yeah, but of course, I'm not saying 19 million debt is good. No. We need to clear that debt. But we have been strong supporters of KEMSA. But once you request KEMSA for drugs, probably they will be able to fill 60%, 40% they will not be able to fill. So we have engaged a Catholic Church-owned supplier called Meds. So Meds is able these days now to plug into the system and be able to supply us drugs at our hospitals. Of course, there are also instances where we get it from private, but that tends to be the last resort. So the first is usually KEMSA. If KEMSA, Meds. If Meds, private. Yes.
Okay. There used to be talk of a lot of people who would leave the dormitory counties of Nairobi, Murang'a being one of them, to come to Nairobi for specialist care. Since Kangata Care came into place, do we see that specialist care now is available and can be operated within the county and you don't have to leave to get it done?
Yes and no.
Okay.
Let me start with no. Nairobi still retains the uniqueness of having the best healthcare in some areas. Take, for instance, cancer management. I think definitely Murang'a needs to work on that. I see a lot of people coming to, let's say, Texas Cancer Center in Nairobi with the card of Kangata Care. We usually get the reports. So quite a number of our patients come to Texas or KU Hospital or Kenyatta seeking those very specialized care. Yes, but not because of Kangata Care per se, because of other factors. Like, for instance, Murang'a has introduced something we call telesurgery. Telesurgery means you can now be operated in Murang'a by a surgeon, but there are other doctors who are helping when they are far away through the internet. So a doctor has a gadget fixed, and when that gadget is able to look at the operation room, and the other stakeholders who are able to contribute to that from far, that then boosts the presence of expertise in Murang'a. Yes, also to the extent of also telemedicine. Telemedicine is the lodge. We have introduced telemedicine in about 13 rural health facilities. Today, another 10 will start doing the same. That will be about 23. Patients with these chronic ailments used to travel all the way from the rural Murang'a to Murang'a level 5, because that's where you find, let's say, a cardiologist to get treatment. And that costs you about 1,000 to reach Murang'a. Then you have to eat lunch. You lose a whole day.
It's a cost.
It's a cost. So we came up with telemedicine. The idea is when you are far, let's say in Kigumu, you go to the nearest facility, you talk to a doctor who is in Murang'a. He gives you that care. Then you don't have to travel to Murang'a. Probably we think if we upscale that, we'll now get to the expertise in Nairobi. Maybe even in India, maybe years to come, maybe even in America, years to come. And also, yes, to the extent we have some partnership with some European doctors in Maragua. There's a doctor, Dr. Victoria is a Spanish doctor who lives in Maragua Hospital. He has an organization which brings European doctors, and they offer specialized surgeries in that hospital biannually. They do plastic surgery. So they were there from, I think, from Europe 1 week ago.
Okay. Governor, we thank you very much for coming. I wanted to ask you a question about, the relationship with the national government, particularly in the delayed disbursement of funds and how that affects service delivery at county level. But that's a conversation for next time.
Thank you.
Asante for coming.
This is the Situation Room, the only way to start your day.